On Point, a new storybook titled My Hero Is You, How Kids Can Fight COVID-19 has been produced by a collaboration of more than 50 organizations in the humanitarian sector. The book, aimed primarily at children aged 6 and 11 years old, is a project of the Interagency Standing Committee on Mental Health and Psychosocial Support in Emergency Settings. Now, with help of a fantasy creature, Ario, the book explains how children can protect themselves, protect their families and friends from coronavirus. To give us more detail on the book, we're joined by Sarah Harrison. She's the technical advisor and co-chair at the International Federation of Red Cross Red Crescent Societies. Sarah, thank you so much for your time. Talk to us.
Thank you for inviting me.
Yeah, let's start off by looking at what inspired the book.
The main inspiration from the book came from the fact that about a few weeks ago, almost half of the world population was in lockdown inside their houses. Children were unable to go to school. Parents were being given additional childcare responsibilities for their children during the daytime and trying to work and trying to explain to children the whole new environment that they were now living in, and what was this virus, how do we speak to our children about it, and also address our own fears. So that's the primary motivation for the book.
I understand in the beginning a survey was sent out in order to assess the mental health and psychosocial needs of children. Talk to me about the results that came back and how those results impacted the book and how you update it.
Yeah, so a survey was sent out at the very beginning before we'd even started writing the story for the book. And the survey went out in multiple languages, in Arabic, English, French, Spanish, Italian and Portuguese. And it was sent out through a whole variety of different networks, mainly relying upon people's personal connections and networks. So it went out through different teachers' associations. It went out to the humanitarian community through agencies such as UNICEF, World Health Organization and my own. And the questions were very much related into two sections. One section was looking at specific questions for children. Some were quite simple, such as what do you know about the virus? What do you think about when you hear the term COVID-19 or coronavirus? What are your fears and worries in relation to the virus? And also, what activities do you enjoy doing at home? Or what do you best like about the fact that you're at home? And that was for the children. And we asked the parents to directly ask those questions to the children and then record their answers almost verbatim as a qualitative response in a Survey Monkey. And then there was a second part of the survey, a part B, that was related to direct questions for parents or for caregivers, asking what questions does your child have about COVID-19? What information do you need to know in order to be able to care and provide information back to your children again? And we had over 1,700 responses from children and parents. And a lot of the responses that came back implied that, particularly from parents in some parts of the world, many humanitarian settings which had been under conflict were concerned about talking about issues to do with grief and loss with children and death around the virus. So very sensitive topics, particularly because they had had a higher exposure to that because they had were also still living through a conflict in their country. And other issues to do with children were more related to their change of routines at home. So some children were quite happy that they could spend more time with their parents at home or their caregivers. It was an opportunity for quality time. And some children were concerned about the disruption of their routine, missing their school friends in particular, and just not knowing how long the lockdown would last for. So they were really wanting someone to be able to say, okay, in 2 weeks, in a month, life will be back to normal again.
Right. Now, I've read the book and I must say that I really enjoyed it, even though it is for ages 6 to 11. What kind of feedback have you received thus far now that it's out in the open and parents can read it to their children?
I think the feedback has been overwhelmingly positive, but there had been books previous to the one that we released that were addressing similar topics, but didn't have the specific themes in relation to mental health and what we call psychosocial support as well. And I think that ability to be able to talk about sensitive topics, for example, like death, like fear, like worries, both for parents and children, enabled the book to enable parents to sit with their children and read the book, and then also to answer their questions. So there's been a massive uptake of it globally. It's being translated in over 92 different languages now. And it's also being picked up particularly by UNESCO, who's keen to see it linked with education curriculum. It's also been picked up by teachers' associations, as well as coverage in a number of newspapers and publications internationally. So last week it was also designated as one of the positive things, or the good thing that happened last week in the world, despite the fact that we have this COVID-19 virus outbreak. So there's an enormous absorption. It's been sucked up almost like a sponge sucks up water globally and literally all across the world, in every community.
Right, Sarah, we have to leave it there. Thank you so much for your time, and I'm sure in the future we'll have conversations about how we not pursue basically a one-size-fits-all approach when it comes to mental health and psychosocial needs. Thank you so much for your time. Of course, that is Sarah Harrison. She is the technical advisor and co-chair at the International Federation of Red Cross Red Crescent Societies. That's it from me. We're going to have more news with my colleague Nzinga Gunta at the top of the hour. Your weather details are up next. It's a good afternoon from me.